Aiboan, Vanakkam, Assalamu alaikum, and greetings to everyone. Distinguished speakers, comrades, friends, ladies and gentlemen. My name is Lionel Bopage. I am speaking to you on behalf of the Voice for Democracy in Sri Lanka, an international collective which is hosting this webinar. As one of the co-conveners, I take the pleasure in welcoming and thanking you and everybody else who has taken the time to join us today via our Facebook page and YouTube channel. I also warmly welcome the guest speakers. Let us first acknowledge that this webinar is being conducted from the traditional lands of the First Nations of Australia, the Wurundjeri people of the Kulin Nation, the traditional custodians of this land. We pay our respects to their elders past, present and emerging, and the elders of other communities. The COVID-19 pandemic has directly harmed the populace regardless of their income status. Recently, we heard the death of well-known individuals such as the former Minister Mangala Samaraweera, a friend who earned our respect in many ways, and the chairperson of the Capital Maharaja organization, Mr. Rajendram Rajamahendran, known to many as Kili Maharaja. I take this opportunity to share the grief of the many Sri Lankans at home or abroad who have lost their family members, colleagues and friends due to the spread of the current pandemic and the devastation it continues to cause. Our thoughts are with them wherever they are during this difficult time. We wish all of them peace, comfort and courage to face the days ahead. I will be moderating this webinar and wish to thank my colleagues, Mr. Ranjit Veerasinghe for the technical and administrative assistance, Mr. Greshan Anthony for the administrative assistance, and Mr. Mansu and Ms. Ariyaratne for kindly helping out in the interpretation work. Now to some housekeeping matters. The webinar is conducted in English. Those who wish to follow the Sinhala translation or the Tamil translation, the translation facility is not available on our live streams. You need to join the live webinar. Please follow the instruction you see now on your Zoom screen. At the bottom of the screen, you should see the control panel with different icons. On the bottom right-hand corner, the second last is the interpretation icon. Click Sinhala or Tamil, the language you wish to follow, and then click Mute Original Audio. If you cannot work this out, please post a comment in the chat box to that effect to Mr. Ranjit Veerasinghe, who is on hand to help. Sri Lanka has made significant gains in essential health indicators such as life expectancy and infant mortality rates. We eliminated malaria, tuberculosis, filariasis, polio, and neonatal tetanus. When the pandemic started in the year 2020, Sri Lanka experienced a relatively low number of infections and resulting deaths, despite the worsening global corona pandemic. The spread of the pandemic was initially managed successfully through swift responses. However, with the rapid spread of the third wave of the Delta variant, the healthcare system has become fully stretched, and the healthcare resources and the system have become strained and overloaded. The pandemic has widened the inequalities that already existed in our societies. Even before the pandemic started, the situation was getting worse. All indications are that it will continue to get much worse. Routine healthcare systems have been disrupted with the pandemic's economic, healthcare and psychosocial impacts causing the world to deliver a historically unprecedented crisis response. In responding to direct and indirect requests of diverse government agencies in Sri Lanka, expatriate communities raised funds to provide much-needed critical equipment, such as ventilators, nebulizers, multipara monitors, and pulse oximeters, to treat the infected. Obviously, prior to the onset of the third wave, these donations contributed to saving many lives, improving healthcare responses, and keeping the health system in a state of preparedness. The focus was mainly on the treatment of the infected. Nevertheless, we mostly disregarded the precautionary principle. Prevent the spread should have become the healthcare motto. Rather, those in power were not so much concerned about the restrictions or lockdowns, but about keeping the economy open. The precautionary principle was thrown by the wayside. Living with COVID has become the mantra of the day of the political classes. Lifting restrictions too soon may only lead to a COVID resurgence, endangering the healthcare system and the workers themselves, like in Israel, the United Kingdom, or in the United States. Social restrictions to prevent the spread will have to continue for lifting restrictions safely. The healthcare crisis has called for a new agenda that envisages a health system based on individual needs and not according to what an individual can afford to pay. This needs to be the overarching policy position for transforming the primary healthcare system to a system that saves lives by improving people's health and working towards universal health coverage. Here, we cannot forget the fact that the right to receive proper health care is a basic need and hence a fundamental right, regardless of one's religion, creed, or class. During the webinar, each panelist will make a 15 to 20-minute presentation. At the end of the 4 presentations, any questions the audience pose will be discussed. We may have about 45 minutes for such a discussion, at the end of which the webinar will be concluded. Please feel free to post your comments and questions in any language you wish, but be brief. You may use the chat function or the Q&A feature in Zoom. Thank you. Let me now introduce our first panelist, Dr. Nilanga Samarasinghe. Dr. Samarasinghe is a health economist and holds a Master's of Arts degree in Health Economics and Policies. Currently, he serves as a researcher at the Department of Health Sciences and Medicine of the University of Lucerne in Switzerland. As a graduate of the Faculty of Medicine of the University of Kelaniya, he served the Ministry of Health in Sri Lanka as a senior doctor. He was formerly chairperson of the National Dangerous Drugs Control Board. While serving there, apparently he had information about drug traffickers and the politicians who supported them, and his life was under threat. And he had to leave the National Dangerous Drugs Control Board, and now he lives in Switzerland. Many of those in power appear to be opposing the imposition of restrictions. The value of human life as against the economic loss caused by restrictions is being debated. Without further ado, let me invite Dr. Samarasinghe to the floor to make the presentation, COVID pandemic and the lockdown quandary. Thank you.
Thank you very much for your wonderful introduction, Bopage. And thank you very much again for this webinar of Sri Lanka battle on COVID-19 pandemic. Lionel asked from me to speak on COVID pandemic and the lockdown quandary. I believe the organizers meant by the word quandary is dilemma. Am I correct, Lionel? Or the state of perplexity or the uncertainty of what to do in uncertain situation. Hence, the very limiting factor in our webinar is time. I do not want to explain to you what COVID is. Is it an RNA or a DNA virus? Or what is endemic? Or what is a pandemic? As we all know quite well, that is what they are. My main focus is on lockdown. And why has it been a dilemma in Sri Lanka? What has to be done? What is being done? And what must be done in the future? Dear friends, though I am living in a foreign country, I am very much concerned about this matter, since Sri Lanka is our motherland, of course, the motherland of all of us. This is my sole motivation and nothing else. Also, in addition, it is the place where we think of being buried peacefully one day, our last resting place. Dear friends, in any country, there are two groups of people. First is the government, a small group of individuals who govern us. Second, the large group of people who are governed by that small group of individuals. In democracy, the small group is elected by the large group. Simply for what? It is to implement their will, the will of the people. Friends, it's a bilateral agreement. It's a mutual agreement that the government is bound to. With whom? With the people. In this, the government has promised and taken the responsibility towards the people. Before they have been elected, they promised they would take care of all the problems, all the conflicts, and all the crises. Then, now, and even in the future, which people may encounter and threaten. Can they breach this sacred agreement now? No, I don't think. No, they cannot. They are obliged to fulfill this contract and commission. Government was elected solely for this and only this alone. This is the purpose of every elected government. If this is not the duty and obligation towards the people, what's the sense does it make in electing a government, feeding and fostering them with all the lucrative facilities, benefits, and privileges at the people's own expenses? Can somebody explain that to us? Government is for the people, by the people, of the people. The government has promised them to think and work diligently in the people's own interest. The government has promised them by saying, don't worry, we will fix everything. Now, can they turn around, go back and say, this is a different kind of matter or a problem that we are not familiar with, and that is very new to us? Or could they say like this, මේක යුද්ධයක් වුණා නම් අපි දන්නවා කරන්න ඕනද? මේක මේ ඇහැට පේන්නේ නැති කුඩා වෛරසයක් යන්නේ. Are these stories of any worth or value? I couldn't see. Is this the agreement between government and the people? Or could the government say something like this? If this is a ත්‍රස්තවාදියෙක් වුණා නම් වෙඩි තියලා මරලා දානවා. ඔයාලා අපි කියන දේ අහන්න නැතුව පෙළපාලි කියලා බෝ කරගත්තට අපිට කරන්න දෙයක් නැහැ. Can say like this? Is this what government means or the governance mean? Transferring the responsibility and passing the buck when the case is unfamiliar or difficult one? No, I don't think. If the government can't keep her promise, there are two alternatives they can take. One, to resign from the agreement. Second, or go in for a new agreement. Indeed, there has never been a ruler ever born who willingly resigns. So we go for the second agreement. Indeed, there has never for the agreement. If the ruling body is humble enough to understand that they are not capable of coping with the task, then they should make a plea for the people's support. As a nation, Sri Lankans are always there to come forward to serve the country as proven in the history, to safeguard the interests of the motherland, so the government, by forgetting and putting aside all the prejudices, all the differences, and all the discriminations, just as what has It happened in the tsunami period and during the last phase of the war against terrorism. So I think the organizers have given the name correctly for this webinar. The war or the battle against the COVID pandemic. Since it is not affecting only one group of people or one part of the country, it was and it is high time to unite the nation as one against all the differences and the discriminations and prejudices. My dear friends, I am ashamed to tell you, Sri Lanka lost again another diamond opportunity to unite the nation. That is one of the brightest side of the COVID pandemic we should not fail to see. If I am share my experience with the audience, I can recall how Switzerland, my new homeland, prepared for the pandemic. When we got the news that the China was hit by a virus, it was just another news report for us. Who cared? It was their own problem. We thought it must be solved by themselves. Though we are bragging and talking nowadays that the world is a tiny universal village, we did not think at that time it would ever hit Europe sooner or later with this force and scope. But when it hit Italy, it opened our eyes. Whose eyes? Are the eyes of the government? Are the eyes of the people? No, the eyes of the academics, the eyes of the think tankers. Before government could invite them to prepare the strategic proposals to combat the pandemic, they had prepared already themselves for what? To brief in the government when they are called upon for preparing the strategic plans to combat the corona pandemic. Not only the academia, please believe me, 1 in every 40th citizen in this land has sent letters to the government with their proposals of what to do and what not to do. You see how the citizens' participation in war against the pandemic. Dear friends, as one good side of these academic discussions was, I myself prepared a strategic plan, keeping Sri Lanka in mind for the developing countries. War against COVID pandemic after being inspired by my fellow academics. So, dear friends, the rest of my talk will be based on the key points of my concept paper. There we recommended to the government, before any kind of lockdown is imposed, it must assure the continuation of compulsory food supply, compulsory medical facilities, compulsory transport, and compulsory domestic infrastructure facilities like water, electricity, gas, oil, and internet. Sri Lanka is a country that has all these decent amenities. The only part lacking is the management. I would stress that one again. The only lacking part is the management. The country has gone into the dilemma because of that. And this is a great example of the government, state, and the local academia and the think tankers are failing, and how incapable and how weak and how their sedentary and luxurious life has blunted their brains and abilities and capacities to propose a good plans to the country, to the government, to this war against pandemic. Minds the authorities sleeping, we the outliers, of course, the some academia out the government has made the proposals and action plans. In our proposal, we have proposed 8 safety nets to combat the war against the pandemic. First, finance net to combat financial issues during the pandemic. Second, food net to ensure the essential food supply to the nation. Third, health net to ensure the medical needs of the affected community. Fourth, power net or the administration net to bring all political and statutory bodies to defeat the crisis. Fifth, education net to ensure the children's right not to miss their lessons. Sixth, transport net to ensure the passage of the movements of people and goods. Seventh, industries net not to lose the income generation. Eighth, information net to ensure the accurate and timely information of the pandemic and the situation of the country. Dear friends, the very first thing we must introduce is for any disaster is having a good disaster management fund, a sustainable fund that only uses in a disaster situation, nothing else. We proposed how to find the money for the whole course. And we propose how we ensure the living of daily wages employees, the community most affected by the pandemic. We proposed how we could transform this lethal crisis into a golden economic opportunity to climb up to the club of developed countries, whilst the many other visionless countries are going down the path to hell. We are explaining how we could transform our security forces to a national guard force, the savior of the affected communities, with no regard to ethnicity or religion or whatever the thing divide the people. In the health net, we explain how could we mobilize the full strength of the health sector accordingly and appropriately to address the health issues. Not only the issues of the COVID patients, but also the others, not missing even the reproductive health, sexual health, substance addiction, etc. Up to date, the main strategy for mitigating the COVID pandemic in Sri Lanka is absolute minimizing of transportation. It is one of the biggest measuring tools of the mindfulness of our authorities engaging in the COVID pandemic management. To maintain the physical distance among the people to mitigate spreading of the virus is providing more and more transport facilities and encourage people to cycling and motorcycling. What does the authority of Sri Lanka do? Just the complete opposite. In this hour of need, we recommend the government to integrate and mobilize all the passenger vehicles above 7-seaters to ensure enough public transport. Dear friends, the power net too is one of the most important safety nets. No one must attempt to use a disaster for political gain mileage or a part of the power battle. The ultimate responsibility lies in bringing all the political and civil societies to one front to battle the pandemic is with the government. If the government will not do so, no one could blame others. They put politics and petty goals above our crisis. That is the reality show staged in Sri Lanka nowadays. If the government party and the opposition parties are searching for the political opportunities on top of the death bodies of COVID pandemic, what a country it is. It is human. It is the opportunistic nature of humans. So we do not blame any of them. Therefore, my friends, to prevent that, we must constitute the regulations to work together in a disaster scenario is mandatory. We have to make it mandatory to work together all the parties and all the relevant parties together if a country faces a pandemic. Though all the medical experts are asking for complete shutdown of a country, no responsible government with a good conscience could do it. If I bring you all back to the history, even during the worst scenario like Second World War, industries were run, agriculture has been done, while definitive bombing had been happening directly on the head of the innocent people. Hence, we suggest industries must run with the strict precautions. The important word is strict precautions. Saving the nation is saving farmers. Saving the nation is saving the workers, saving the economy, and saving the society. Not only the monthly wage, white collar middle class. So we are proposing a lockdown model which can cover and address all these issues. At the end, we suggest a good information or the communication net, because no true information, there is no true control. Dear friends, if you carefully note, the worst case scenario is happening in the country. In the country is due to the misinformation, nothing else. The government-friendly media mogul thought the virus is also like Sri Lankan waters. They thought the virus could also misled by Paniya, Dumhattiya or Kandahattiya, like what they have brought in the elections, like Kalininaya, Vadakottuho, Dr. Safi. But the government and the Sri Lankan diasporians like us are blaming the Sri Lankan citizens for their misbehavior. It is the only example in nation in the world has gone to a self-lockdown, since the people have no reliable information on what going on is and what would be next, whose life next get by the corona, yours or the mine. We have noted that government and the governance is breaking down instead of country lockdown. If the nation lost its head, it is the worst scenario that could happen to any country. So I thank to the organizers for this great effort to send the message to our motherland, its people and the government, what to do and what not to do. And please send the message also. There are thousands of grateful people all around the world. If the mother country needs their assistance in every kind of. In the concluding note, I emphasize again, still we are not too late. Indeed, we are late, but not too late. With a good strategic plan, with right people in the right places, still we have a good chance to win this war. The war against COVID pandemic with the minimum damage. That's the word, with the minimum damage. One day this pandemic will be over, but the only question is how big the compensation we pay, how many human lives we sacrifice, where we end in social, economic, and other all aspects. As a health economist, I will ask from you, is it cost benefited? If the country has a vision, I am sure COVID will be a new beginning. COVID will give a light to the new normal world. So thank you, my dear friends, listening for me. Thank you again.
Okay, thank you, Dr. Samarasinghe, for providing your thoughts on, especially with regard to how a democracy would operate in the conditions of a pandemic, and before going for a lockdown, what the democracy needs to do to minimize the inconveniences of the people and so on. And you enlightened us as to what should happen, and also compared the value of a human life under the conditions of a pandemic compared to the economic loss that would be caused by a lockdown. And we have to have that balance, and I think human life should be given prominence in that regard. So thank you once again for your presentation. Our second panelist is Dr. Nihal Abeysinghe. Dr. Abeysinghe is a graduate of the medical faculty of the University of Colombo and personally a long-standing friend of mine. He holds postgraduate degrees of Master of Science and Doctor of Medicine in Community Medicine. He is also a fellow of the American College of Chest Physicians. He is a practicing consultant in epidemiology and community medicine and currently serves as Deputy Director of the Institute for Research and Development in Sri Lanka. Formerly, he has served as the Chief Epidemiologist of the Ministry of Health, the President of the College of Community Physicians in Sri Lanka, and the Regional Advisor of the World Health Organization in Southeast Asia. As the Secretary of the National Intellectuals Organization, he very much encourages the active engagement of intellectuals and professionals in the effort of building a better Sri Lanka. Dr. Abeysinghe, with other medical experts, advocated for a lockdown. They have also warned that the failure to do so would increase not only COVID mortality rates, but also the deaths due to other diseases. I invite Dr. Abeysinghe to share his views on the question, is Sri Lanka teetering on the brink due to COVID-19? Over to you, Dr. Abeysinghe.
Thank you, Dr. Lionel Gopage. Thank you for the invitation. Could you kindly allow me to share the screen, please?
Yes, I have authorized. Yes.
Hope you can see my screen. Can you?
Yes,
can you
yes,
see my
we
screen?
can see. Yes.
Okay, thank you very much. So I will be very brief, and I will let you know what the situation is and how we progress during last 1.5 years, and what we could do, and what we should be doing. In the next couple of months to avert the deaths that really happening in the country. So let me start. Thank you very much again for the Voice for Democracy in Sri Lanka, based in many countries, including Australia. So thank you very much for this opportunity. If you really go back to the history, globally we had situations like this in 2002-3, and then again in 2012 and 13. It was SARS in 2002 and 3, and then 12 and 13, it was the MERS in the Middle East. So following these two episodes, globally there was a discussion to what we learned from these almost pandemics, not as Spanish flu in 1920s, but these two are the recent epidemics that cause near pandemic situations. But globally, we were able to prepare for responding. We were able to respond to the epidemics, so managed to avert any pandemic. But in 2009, there was a declaration from the World Health Organization when we had the avian influenza pandemic epidemic in 2009, but it did not lead to a pandemic. So this pandemic has come 100 years later than the Spanish flu pandemic in 1920s. So these were the lessons that WHO shared with the globally with the countries when we had the MERS, SARS, and the influenza epidemics in the last 10-15 years. You can see the communication has been identified as the key, the highest political commitment, multi-sector approach, and evidence-based action, transparency, and confidence among all, and efficient alert response, and then the rapid sharing of data and information, and global partnerships. So these lessons we knew when really we came across this pandemic in early 2020. So, but when it happened in 2020, in January, the World Health Organization declared that there is a urgency to respond to a possible pandemic, and then a large number of cases reported in China, and then later in Europe and in America. So during that period up to March, so I mean the world, many of the other countries were preparing for the pandemic or epidemic if it comes to own country, but Sri Lanka actually, I mean, to my knowledge, we were not much interested in preparing to face an epidemic. So I mean, so our preparation was not standard, and we did not learn from the earlier lessons that we learned during the last 15 years of the pandemics that we had in globally. And in fact, I think Sri Lankans thought, maybe including the government, that like SARS, like MERS, that this one will not hit Sri Lanka. And then, I mean, if you can remember that there was one Chinese lady who was affected, and following that, I think, I mean, though it was not released, I think the Tourist Corporation, they prepared a video and to share and bring down the tourists from the world. But I think it never, it never released later. That was the preparation. And then the response to, I mean, the early response of the government was very too much to stop the spread of the epidemic. And if you can remember that there was a plan to accept the nominations for the parliamentary elections on 19th of March. But the cases coming in the early March and the middle of the March, and those were tourists coming from other parts of the world where the epidemic was going on, and our own Sri Lankans who were coming from those affected countries. So at the beginning of March, there was some, opportunity that people took arrive in Sri Lanka. So therefore that those who had the opportunity, they arrived in Sri Lanka in early March. But towards middle of March, we were realizing that the cases are increasing and people are coming in. And so therefore that the government was planning to do something like lockdown. But what happened was the government wanted to have the nominations, and then on 19th of March, government received the election commissioner received the nomination from the parties for the parliamentary election. And then the day for election was 25th of April, but the government has to declare a curfew or lockdown during that period. And then in this part of the story, the government want to have the election anyhow, because they had only the presidential election. So they wanted to have their own parliament. Majority was from the opposition during that period. So they wanted to have the parliamentary election. And then they imposed severe restrictions at the beginning. And in fact, I can remember as National Intellectuals Organization, and we requested only 14 days of lockdown, but the government continued to impose curfew and lockdown until around 25th of April, thinking that they can have the parliamentary election. But because of the two small outbreaks that in Valisara and Kandakadu, they had to postpone the election and then continue their actions. And up to May, there was this so-called lockdown period, and then it was okay, and had the elections in August, and then the government started the releasing the grip, and people were also thinking that Sri Lanka defeated the pandemic. So therefore that there was a little bit of euphoric situation between August and early October. And then during this period, during the early restriction period, there are fairly high economic loss due to a standstill of the economic activities during that lockdown period. And then the government has to feed those who are having having a low income, and it's around large number of people. And then government gave, I think, 2 rounds of 5,000 rupees because they were aiming at the election in August. And then this October wave came in early October, and then this time the government response was different. Then the government started responding like the West, and did not want to go for a lockdown or restriction of movement, but starting locking down smaller areas. But because of that, because of this response, that Sri Lanka could not open the schools, could not open the universities, so education very badly affected. But a certain the restrictions were minimum, so therefore the economic activities was okay in the 3rd and 4th quarter, and in the 1st quarter of 2021. But unfortunately, and during this period, there were deaths compared to the previous period. Up to October, we had only 13 deaths, but during this period, there were a large number of deaths up to April. And then it really affected the education of the children. And then we knew that there was this alpha variant coming that was in India. And then the India reported Delta variant. And we were aware that the Delta variant was spreading in the other parts of the world. But government decided to continue opening and then have the New Year celebration in 2021 April. And just after the New Year celebrations, we came across this third wave, and initially with the alpha variant. And you could see here that the first it was the alpha variants at the beginning of the 3rd wave. I mean, actually, after the December 2020, and then in April, the Delta variant started spreading. So this graph is courtesy of Professor Nilika Malavige. She the one who is doing our sequencing at Jayawardenepura, and she shared this graph with us when we were having at the WHO level discussions in the country. And this is what is what you see in the epidemiology unit website. You can see it's very clearly the waves since April, and then we are now having about 4,500 cases a day and more than 200 deaths. And then you know that when we look at the what is happening in the ground, that we believe that 3 times more than these cases are in the field. And then the deaths, there may be some deaths are not reported, but I think eventually these deaths will be reported, and even after the disclosing the numbers of each day, at the end of the day, the epidemiology unit is adding the additional cases and the deaths to the statistics. And then this is the death curve that you can see that during the last 3 months from April, that it is now still rising the death wave. And then you can see that where we are among the other countries during this period. So this is 24th April, and these graphs that shared by my colleague, Dr. Sapumal Dhanapala, who is at the World Health Organization office in Sri Lanka. And we have a small group at the World Health Organization level. We are ex-WHO and senior colleagues from Sri Lanka, who are a small group. Every 2 weeks, we are meeting and we are providing our observations to the government and recommendation. And then now we have started sharing our recommendations with the public. And you can see that Malaysia, United Kingdom, and United States, that the rates per 1,000 population is high, but then you see that Sri Lanka is having a large number of cases reported. Even this number reported is low. We know that it is underreported, but with this underreporting, that Sri Lanka is now among the other countries which are reporting very high case rate compared to other countries, even in the region, where they had the Delta wave came in early, like Indonesia, Bangladesh, India, Singapore. And sorry. And then you can see the death rate. You can see that the Sri Lanka, Malaysia, Indonesia, Sri Lanka is really now among the top countries reporting reporting the cases as well as the deaths now. So we are heading for a very bad period for the next couple of weeks or months. And now we are under lockdown, and government wanted to lift the lockdown on the 30th, but because of the pressure from outside, including ours, now decided to go until 6th of September. And this is one thing that we are doing well. I mean, you can see that our vaccination rate is fairly okay, and we have got donation from India, US, and China, and we have about 57% of about 30 people are now vaccinated. 27% have received they are fully vaccinated, and another 30% have received only one vaccine. And still the deaths are occurring among the unvaccinated and people with one vaccination. So we believe that our plan was actually this is because our plan was changed. We prepared a national plan. I was in that committee. We have a communicable disease committee at the epidemiology unit level, the Ministry of Health, and we have been functioning for about 50 years for this particular purpose of handling outbreaks. And we prepared this vaccine action plan, deployment plan, and then our priorities were elderly and comorbid. But suddenly the government changed its strategy and then went for vaccinating 30 to about 30 people, and we missed the elderly group and the comorbidity group, and now the people who are dying really in this group. And then you can see that where Sri Lanka stands among the other countries, our the rate for population, the cases 100,000 population, and then the millions when it comes to the compared to the population. Sri Lanka among the high rate countries having higher rate of incidence for 100,000 population. So you can see Sri Lanka is in brown. We have more than 300 per 100,000 population during last 7 days. And you can see that we have deaths reported in the last 7 days, more than 6. So we are among the highest death reporting countries in the world. So, I mean, what as an epidemiologist, what we could have done, basically to have a national body to advise the government, we missed that opportunity. Even we were not using the committee that we had, and the government decided to have its own presidential task force with known to them and those who are close to the government. And then they are the people who are still advising the government what to do. So, I mean, we can't see they use any evidence, any scientific facts in making these decisions. And then we do have various agencies implementing the decisions, but we see that they are working in isolation. They are not really working together. And then in the private sector, now they have expanded the hospitals, and they are now accommodating hotels for asymptomatic patients. And some hotels now they have 3-4 some hospitals, private hospitals, now they have 3-4 hotels accommodating asymptomatics who can afford, and the other people are going to the government hospitals. And government hospitals are now overloaded, and then and most of the people are now in the community and waiting to get admitted in the hospitals, and sometimes even without having adequate treatment in the community and waiting to get admitted. So and we would have had a parallel provincial, district and health unit implementation network. We don't, but they are working as it is, as the units in isolation. And then we really do not have at the moment a proper monitoring framework or a national body to monitor, guide the media and the social media. So in our, we have almost now in a very bad condition for cases and deaths in the country, and we are under lockdown. And unless government now at least take the appropriate action, and we will be having more deaths and more cases, and we all are vulnerable for dying. And maybe it is that is now what we are doing, is that we are trying our best to educate the people, communicate with the people, but our biggest failure was in the public education, engagement and empowerment in reacting to this pandemic. So that's the message that I can convey to you, and I am prepared to answer any of the questions that you may have at the end. Thank you very much.
Thank you, Dr. Abeysinghe, for enlightening us about what is going on in Sri Lanka, especially with regard to the management and control of the COVID pandemic. And you highlighted the grave risks the country is facing at the moment, with segments of the population. I mean, according to what I heard, in the plantation sector, in free trade zone, people have been suffering, and people getting infected, and they are left in danger. And about the paralyzed healthcare network and so on. This obliges Sri Lanka to maintain a proper and consistent approach towards a consistent policy and an equitable framework of delivering the healthcare program. Thanks again for your presentation, Dr. Abeysinghe. Our next panelist is Dr. Ms. Nalayini Sugirthan from New South Wales, Australia. Here, I would like to thank our friend Mr. Anthony Gratian for convincing Dr. Sugirthan to be part of this webinar. Dr. Sugirthan is a graduate of the medical faculty of the University of Jaffna and currently serves as the president of the Jaffna Medical Faculty Overseas Alumni, Australia. She also maintains a keen interest in refugee health as well as mental health. She also serves as a general practitioner supervisor at the Universities of Sydney and Western Sydney, and also as an examiner of the Royal Australian College of General Practitioners Fellowships. As a private medical practitioner, she has hands-on experience with regard to what is going on in the state of New South Wales. As we know, the third wave of the pandemic continues to escalate in Australia, causing many hospitalizations and deaths, which parallels what is currently happening in Sri Lanka. Without further ado, I'll invite Dr. Sugirthan to the floor to make the presentation, Challenges in COVID Crisis Management, General Public Perspective. Over to Dr. Nihal. We can't hear, no? Sorry.
Can I share the screen?
Yes, yes.
Okay. So, can you see everyone?
Yes, if you could,
Okay.
if you could enlarge the screen, that would be better.
Sure.
Yeah.
Fine.
Yeah. Thank you.
Okay. Thank you. Thank you, Mr. Lionel Bopuke, for kind introduction. Also, thank you, the organization Voice of Democracy in Sri Lanka, for this great opportunity for inviting me as a guest speaker, particularly Mr. Gratian Anthony as well. Okay, so what are the challenges we are facing in this COVID crisis management? So I'm just going to talk about only the general public perspective. As I'm a general practitioner, I would like to talk about, compare Australian guidelines and with the Sri Lankan, at this stage, Sri Lankan protocols or guidelines, whatever available. So the first challenge I wanted to highlight here, understanding about the COVID-19 Delta variant strain. So a lot of people in Sri Lanka not understand actually the severity and the seriousness of this COVID-19 Delta variant. So Delta variant is more contagious, and the transmissibility is more than twice as the original strain what we had in the past. And it's spreading via the air as well. And its effect irrespective of any age group. So that is again, so very hard to manage the situation in anywhere, any part of the world. And individuals spread the infection to others before identifying the symptoms as well. So when we see a patient with the symptoms, so before that, the patient infected some the individual who are living in the same house, or whoever traveling with in the same car, or in the workplace. So wherever they go, so they spread the infection very quickly to whoever contact with. So what we thought in the past with the COVID-19 and compared to now the Delta variant spreading currently in most of the countries, I think around 96 countries identified with Delta variant currently. So those all countries having struggled with controlling the infection, particularly in Sri Lanka nowadays, we can see how quickly the infection spreading to community. And the problem is they don't understand the Delta variant, how severe, and they people gathering still, I can I can hear from my friends and relatives who are living in Sri Lanka. So still they are hiding for PHIs and police. So they are still having the functions and gatherings. So funeral house, still people going. And always they are doing that because they don't understand about this Delta variant spread. So the next thing is the ignorance. The second challenge what we face is the ignorance about the COVID symptoms. So always when I had a chat with my friends and colleagues who are in Sri Lanka, they say, then they call me and then asking about the symptoms, and then they say, this is just a flu. I don't have anything. I don't have the COVID. So they always saying this is just a cold, just a flu symptoms. They always saying they don't want to tell, they don't want to identify they are having the COVID because they are a bit scared, and they are reluctant to identify as a COVID patient. So probably there are consequences then if they identify as a COVID patient. Sometimes they may having the consequences is they are worried about. So when they are having the symptoms, they are hiding the symptoms, and they are saying it is just a common cold or flu symptoms. So, but like the COVID Delta strain now, if we are getting, so we are getting the same symptom as the cold symptoms. So what we having is like just a runny nose and cold-like feeling and headache, similar symptoms we are having. So, but like everyone now thinking that most of the people in Sri Lanka, particularly whoever my friends and relatives in Sri Lanka, so then they are saying, then we don't want to do anything. So we don't want to do the testing. We just wanted to we just wanted to take a couple of Panadol to take. So then that will be okay, because this is always, I get it, this common cold and flu with this season. So people still not identifying the symptom, what is COVID symptoms. So I think the challenge here is the ignorance about the COVID symptom, and they are not going to do the testing because they are a bit scared about the testing. So why they are getting scared about the testing is one thing, because they may take somewhere to stay away from the family. That is one thing. And the other thing is their social stigma. They identified as a COVID patient. They feel like some sort of stigma among their community. So that is I found in particularly in north part of the Sri Lanka. I found some of my colleagues are saying, I don't want to tell anyone because if I get this COVID, so they may think like I'm an infected person and like that. So I don't know what is the understanding why they are thinking as this is a stigma for them. And the other thing is they don't have the availability of the testing kits. That is again another problem in Sri Lanka. So the testing PCR and the rapid antigen test, both are available in the private sector recently, I think, and the public sector as well. But like a lot of people, because of the PCR kit availability, so I think the less number of PCR testing done. So Dr. Nihal was saying that the infection was under counted actually. So because the availability of the kits may be the testing kits may be the problem, but the rapid antigen test is not a accurate test to identify. But like still. People who are admitting to the hospitals, particularly in the north side, they are doing these rapid antigen tests. So, but like there are false negative results coming, so that we know that, but still like people not much doing undergoing the testing. And the other thing is they are having a very poor knowledge about the importance of testing, why we need to do the testing, so why we need to isolate after doing the testing. So they don't understand the lot of people, not much, as Dr. Nihal was saying, so poor public education, that is the failure of the our management in the COVID crisis situation. That is the big part. Always the public education, the primary, as a primary healthcare physician, I know that is a very important part in the controlling this type of pandemic situation. So the people not actually having the knowledge about the importance of the testing, and they are reluctant to go to the testing. And if they do the testing, they don't know, they can't go anywhere. They should have stay at home until the results available and getting negative. So, but like people, then if they are a close contact or someone, so they are not doing the test and they are spreading the virus to everyone. So that is the reason behind how this the virus spreading to everyone very easily. So if you see the general safety measures, so that is next challenge, I would say, in the general public perspective. So the wearing the mask is, they are always, a lot of people, when I talk, so are you wearing the mask? They say, no, yeah, when PHI noticed us, or somebody, somewhere the police is there, we quickly put the mask, and then we just, then after that we just, it's very hard to put the mask. So they always, people, I don't know, it's most of the people, but I don't think so it is hard to wear the mask, but like people wearing the mask also not appropriately wearing. That is again, if you come, that is public education is the issue there. So if we wear the mask, so we need to cover the nostrils, and properly we need to wear, and we need to cover the nostrils, and we need to cover under the chin as well, and very tightly on the face. But like if you see this picture, then you can easily see. But a lot of people, when they wearing the mask, what they do is putting under the nose, or they are not properly cover the chin part. So, and they are not wash the hand or sanitize the hands before putting the mask or taking off our mask. So a lot of people not doing properly, correctly wearing, and they are not do the hand hygienic measures as well while wearing the mask. So and other thing is they touching, when they pulling the mask down when talking with people, and then touching the nostrils and touching the eyes or mouth. So then we are spreading the infection extra. So then they are not, without their awareness, they are doing those type of things as well. So I'm not saying that it's not happening in Australia. So then here also, then we can see though a lot of patients doing that, but like we try to educate them wherever possible. But like in Sri Lanka, like then number of doctors and number of health workers for patients are very minimal, so not like Australia. So but like it's hard, but like in the basic problem is, so we need to do the public education correctly, then only we can control the spread. So the government's supposed to do some certain things, as previous two talks they were mentioned clearly. But like the thing is, general public also having some responsibility to do their part to prevent the spread of infection. So practicing good hand hygiene. So we need to wash our hands at least 20 seconds with the soap and water, and clearly we need to wash or hand sanitize with alcohol hand sanitizers. We should have used it, and always we need to practice physical distancing. That also not much happening. I can tell that is also not much happening. And then if stay home order, if there are not much people staying in the home, so particularly in the village side of the country, so a lot of people having their temple festival, and they are hang around and going via the next door via the fence. They put a small hole on the fence and they just go via that, and then they have a chat, and then just a casual chat, like so chatting time they do, and whenever PHI or police come, they ran away. So those type of things are there. So when they put the stay home order, so they should have obeyed. So then public not much responding to the instructions, whatever uh, the government officials whenever they give, but that is again affecting affecting the situation more and spreading the virus very easily. If you say that the next challenge, so how we are maintaining the close context, secondary context, and casual context. So who are the people like close context? So close context, close contact is someone who has been close to the person with infected with COVID-19, and might have become infected with COVID-19 virus. So if the person is close contact, so they should have immediately do the COVID testing. That is not much happening for me with my knowledge. So a lot of people not understand what is close contact. So if you are a close contact person with a COVID-19, you must isolate from other people at least for 14 days. So people thinking if I get positive only, I need to isolate. No. So if you are a close contact, so you should have isolate even the test results is negative. So if you say if you are a household member, so if you are a secondary, that belongs to secondary contact. So if your close contact also negative, and if your secondary contact also negative, so then only you can leave as secondary contact. But close contact, if test positive or negative, doesn't matter. So the person need to be isolated for 14 days. So the isolation rules also then not properly follow in the in Sri Lanka actually. So because there are reasons, not like Australia, I understand totally, but like still people not happy to stay in the room, and they are not happy to stay sleeping in the one room and for the 14 days because they are having the issue and managing, but like they don't, sometimes they may not having 2 toilet bathrooms in the house, but still there are ways we can use the toilet bathroom and then we need to disinfect with the disinfectants and then then other people can use, but still like not much follow the rules. Even they are saying we are at home isolating and we are at home, but like they are not actually following the rules. So that again causes the spread of infection easily. So as a general public, so we should follow whatever advice, and we should then only then spreading the infection can be minimized. So if we see the vaccination, so as Dr. Nihal was saying about the vaccination rate, so Sri Lanka is pretty good compared to compared to even I would say then Australia. So the rate of vaccination is very good, but still if we need to reach our herd immunity, at least I think 70 to 80% of the population getting vaccinated, only we will reach the herd immunity. Then only we can achieve the then at least controlling the infection easily. So the vaccination again, so then sometimes people thinking which vaccination is good for me, so which is not good for me, so they are puzzling around. So if you see in Australia, that is the big problem in for the primary health physicians, then we are having great difficulties with this dealing with vaccination, because they are choosing, because they wanted Pfizer vaccine, they don't want a AstraZeneca vaccine, because then here the options are Pfizer and AstraZeneca. So, but like the thing is, what we advise is whatever the first available vaccine, you should have it. So because we there is a proverb like, so if you have a wall only, you can draw the picture. So then if you are affected with COVID, so you won't be there. So then what is the purpose of choosing the vaccine and then waiting for until COVID comes? So in New South Wales now, the COVID infection the infection rate is very high. So then if we get an infection, so then if we affected with that, so no point like choosing the vaccine and waiting for that. And then so because the availability is the issue. So what I'm trying to say is here, so as early as possible vaccinate. So at least Sri Lanka, that is I would say that not much in the past, then the availability is the issue. But like now, I think from a lot of countries helping to give the vaccines now. So then Sri Lanka going to be at least succeed with the vaccination target soon. So, and the other thing is the health authorities advises. So always PHIs, public health, MOH, say they are giving the advices, but like all the time that is not follow up by the community, because they only on when they arrive to the house, they are just acting. So they are actually not, a lot of people not following up. So as I know a lot of friends in Sri Lanka, so then what they are saying is, so they are not thinking about themselves and their family. So they are thinking how to hide these public health sector, that is PHI or MOH or so police or whoever they are looking after them. So they wanted to hide. So even they get they asked to do the testing, they are not happy to go and do the testing. They, without telling anyone, they just hiding, and they are not telling their friends or relatives. They are visiting their home and then having a chat. So they are spreading the infection easily to others. So then following advice is important, and the reliable resources. So a lot of people, what they do is they just look up the social media and rumors, and they are just getting the news from the various resources, and they get upset about that, and they spreading the news unnecessarily without getting a proper information. So that is one of the challenge in Sri Lanka too, because that is everywhere, but like in Sri Lanka, because if we are not having a proper channel to give instructions clearly, again Dr. Was mentioned in the previous talk. So if we are giving a good public instructions and advices and follow the instructions, so then it's very hard to control this type of pandemic situation. And so then this type of situation, sometimes the legal action is supposed to be taken, otherwise these the spreading news unnecessarily influence the people and then affecting their thinking and affecting their mental state, so unnecessarily get anxious and stressed out. So then the next thing is big challenge is the ignorance in managing the chronic illnesses. If you see that lot of people, what they are having difficulty in getting the regular medications like diabetic medications, so insulin and the blood pressure, cardiac, heart disease medications and all these, because they are very scared to go to the hospitals and they are not getting the medications regularly. So, and they are very hesitant to go to the medical clinics in hospital because they are thinking we get COVID easily if we visit to the clinics. So the problem is they are not monitoring their sugar level, they are not monitoring the blood pressure, they are not doing their regular blood checkup. So if they are not doing that, so ultimately their chronic disease affecting their general health. So if you see that over 65, so at least if someone having those type of medical conditions, so if they are not having the medicines regularly, so then definitely their medical chronic diseases causes the mortality. So that is again very worrying thing in Sri Lanka. So if you see in Australia, so we normally regularly seeing or regularly calling the patient or at least monitoring them. So at least somehow managing to get the blood test done. And here, most of the people at home, they monitor the blood sugars, monitor their blood pressure at home, and they call the GPs and then getting the advices. Okay, so last week even I got few calls. They blood pressure gone up, so they how to manage and things. They over the phone asking, or we are doing the telehealth and doing. In Sri Lanka, so then that type of services not available. So people who are having the money and if they are having the facilities, so they easily get those type of services via the private sector. But like people who are in very poor socioeconomic situation, so they couldn't able to, they are helpless, so they won't get the medications regularly and they won't follow the clinic, so they will end up in real the sick situation, and then it lead to mortality. So COVID is one side, and the other side is the chronic illnesses management is again another challenge the general public facing currently. So then I'm not sure like any other measures for managing these type of chronic illness patients. So I know few of my relatives, they say then within last 6 months they didn't go to the clinics and they didn't check, so they just get the repeat medicine somewhere in the chemist, but like I'm not sure they are taking regularly and doing things. So I'm not sure these type of services anything helping for who are in the poor socio-economic condition. So the next big issue is the mental health. The challenge is managing the mental health issues. So COVID crisis affect the mental health almost most of the people in any part of the world. So it's affect each and every person in certain way. It may be due to the school closure for kids, then their leisure activities stopped, and they are friends, they are meeting together, then playing those type of things stopped. Everything affected by each people having some sort of social impact. So that indirectly causes the mental health issue as well. So stress, anxiety, depression, and obsessive compulsive disorder, those type of common mental health issues we usually come across with any people from anywhere of the world. So but the consequences due to these mental issues, a lot of domestic violence and alcohol overuse, suicide, self-harm behaviors, those type of consequences we clearly we see recently. So in the after this COVID pandemic, so this pandemic nearly I think 18 to 20 months affecting all of us. So we can clearly see in the general practice setup. So a lot of issues we have to deal with. So in Australia, there are services helping for these type of people, the mental health services, hotlines. So there are counseling services, a lot of facilities available. But in Sri Lanka, these type of services is very minimal, but still the services are there. I know in north part there are services available, but like people still, again, the social stigma is the issue for getting the help for mental health illnesses, because they are thinking if we go to the psychologist or psychiatrist, so then they are thinking is like they get mad or something like, so then they don't want to label as those type of people, so then they are very reluctant to treat mental health illness. But this COVID create a lot of mental issues, and so how can we look after ourselves in the lockdown period, or that stay home order was there, will be there at that time, or then when we are in the isolation, that means if you are a close contact, or if you are a COVID positive asymptomatic patient at home, then if you are isolated, so what are the things we can do it? So we need to be stay active, like exercise. Doing exercise is good for your mind and body, and eating healthy food, and stay connected. Social connection is important for our mental health. Stay in touch with the family, friends, or loved ones, and take a break from the social media. Sometimes the social media causes a lot of issues with the mental stress, as I mentioned before, and stick to the routine. So then regular bedtime and meal time. A lot of people, what they do is, if you are staying at home, they go to the bed bit late and they having a evening nap, so then the routine is disturbed. So stick to the routine, and so always we need to monitor our mental health and well-being, so that is very important as well. And if we need a support, so definitely we need to seek for the support, at least talk to someone, trust worthy person, whoever believe, so at least talk to. So those type of things at least helping to keep up our mental health in this pandemic situation. And definitely that social and financial issues with this homeschooling, a lot of kids, person to person contact losing, so the social interactions lost, and the loss of lost jobs and services, and the tourism, international travel affected. So those type of things always, it's we can't do much thing, but like still like those impacts again, as I mentioned, that causes the mental health problem. So it's definitely these financial and social issues indirectly causes the mental affecting our mental well-being, and particularly the social gathering and the cultural festivals all. So that is again for us, it's a stimulus. So if a lot of people, that's why hiding and going and doing, and you won't believe in recently that in Nallur temple festival started, so then people went to the temple, and then in front of the temple they fight with these police officers, because they wanted to go deliberately to this, because they just wanted the freedom for that, but they don't understand the severity and the issue with this Delta variant virus. So I just wanted mention few take-home messages. Uh, when the stay home orders are there, so everyone need to obey that and then stay home, so not staying outside, and try to be at home. And if you have a symptoms, everyone need to test it, so that is need to be emphasized in the public sector. And if you are not following, that is our responsibility to follow the safety measures. So it can't be done by for any individual, anyone. So that is, we should have take our responsibility to do our safety measures, and follow always the health authorities advice, and as early as possible get the COVID vaccination, and each and every citizen's responsibility to prevent the spread of infection. So everyone need to take the responsibility, otherwise as a general public, otherwise it's very hard to get rid of this infection. Thank you.
Thank you, Dr. Sugirthan, for the insights you brought to the topic, especially practical aspects, and from the first-hand experiences you have gained in Australia, and comparing those experiences with what is happening in Sri Lanka. Obviously, there are many useful insights that are relevant and can be used in the situation in Sri Lanka. So thank you once again for highlighting those matters eloquently. We are running out of time, actually. Say it is almost 36 past 10. And I would invite Dr. Vinya Ariyaratne. Probably we may go over the time we have scheduled for the webinar. Webinar was supposed to end at 11 o'clock. So if the participants are willing, I would extend the webinar to by another half an hour. So, okay, let us move on to the next panelist. Our last panelist is Dr. Vinya Ariyaratne. Dr. Ariyaratne is well known as a community-based social activist working for the betterment of the socio-economic conditions of the people of Sri Lanka, and really needs no introduction. He is the president of Sarvodaya Shramadana movement, with which I have a long-standing relationship. Dr. Ariyaratne holds the degrees of Doctor of Medicine from La Salle University in the Philippines and Master of Public Health from the Johns Hopkins University in the USA. He also holds the degrees of Master of Science and Doctor of Medicine in Community Medicine from the Postgraduate Institute of Medicine of the University of Colombo. He also served formerly as a lecturer in Community Medicine of the Faculty of Medical Sciences, the University of Sri Javadanapura. Dr. Ariyaratne is a community physician by profession and a public health specialist. He is also past president of College of Community Physicians of Sri Lanka. Dr. Vinya Ariyaratne, with other leading medical experts, came up with a comprehensive list of recommendations based on evidence on the current corona pandemic. We would like to know what is happening with those recommendations. I have the great pleasure of inviting Dr. Ariyaratne to present his thoughts on COVID pandemic and the way forward. Over to Dr. Ariyaratne.
Thank you very much, Dr. Bhupage, and thank you for inviting me as a panelist today. As we are running out of time, I would like to be very brief and then probably allow more time for the discussion. So the theme is Sri Lanka's battle against COVID-19. So I like to focus more on winning the battle and how to win the battle on the ground, because I have had the good fortune of working at the ground level while at the same time working at the national level, trying to influence some of the decisions that are going to be effective in combating the disease in Sri Lanka. Right now, if I may summarize the situation, which has already been elaborated very well by the previous speakers, we are in a very, very grave situation. The number of deaths and also the daily new infection rate is very, very high. And the government has responded to this situation by having a lockdown. How effective or ineffective that is going to be yet to be seen. And the health sector capacity is exceeded. The hospital beds are full, and there is also community transmission, although it is not officially accepted. So the government responded by, of course, having this lockdown to restrict movements, travel of people, and also took steps to immediately expand the hospital capacity by allocating additional beds to take care of the community of the COVID-19 patients. And also the patient management system protocol was changed with introducing home-based treatment for those patients who were between the ages 2 to 65 who had either mild symptoms or who were asymptomatic. There is a massive social impact on children In addition to their schooling being interrupted, the children are subject to sometimes abuse and violence, which is a major problem. Then the women too are having a very difficult time, and particularly the women-headed households, and then the elderly people. Right now, because of the Delta variant, a lot of young children as well as elders are affected, and the household transmission level is quite high. And because it's generally felt that the home is safe, but it's not the case. With this variant, we know even with the slight movement of people outside the home, and if you don't take the precautions, then you are infected. There is a huge social impact and an economic impact. I'm not going to elaborate on these. Now, the response for us to really have an impact in terms of interrupting the transmission or reducing the spread and reducing the deaths, I think we have to work at different levels very quickly. And we all as citizens as well as professionals need to be a part of the solution. I think there's no point in just trying to put the blame. The blame game is not going to work. But having said that, some of the participants also have raised this question of accountability. Isn't the state or the government accountable to the people? It's a very valid question, and that has to be kept in our mind. Now, before the onset of COVID-19, we of course had a very robust public health care system, and it has won a lot of accolades from many around the world for having a very equitable, universally free healthcare system. But yet there were disparities. We also had a private sector which was very much profit-oriented, and also the traditional Ayurveda and the indigenous medical systems of Sri Lanka. So all these systems have now come into play in one form or the other. So it's a new scenario that we are facing. It's not the kind of traditional healthcare system that we are used to work. Now it's a different context in which we have to operate. So having said that, we all know the problem. What can be the solution now? So as I said, at multiple levels, we have to work. The first is our objective should be to interrupt transmission at the individual and family level and community level. So as it has already been highlighted, the individual precautionary measures, health practices need to be reinforced. We know that there are lapses, serious lapses, and even if we have travel restrictions, enforceability of those restrictions as well as compliance are at a low level. Yet, even with all these lapses in compliance and enforcement, we see a big impact, as we can see from the previous experience, that the moment you have travel restrictions, the incidence comes down. But that is only one important intervention. There are so many other interventions that are necessary for us to reduce transmission and prevent deaths. So at the moment, we have a very very centralized and a hierarchical management system of COVID-19 in Sri Lanka. I must say it's not going to work anymore. You have to decentralize and have a devolved approach. Those of you who are expatriates from Sri Lanka who knows that we have 25 administrative districts in Sri Lanka. There are about 350, 360 medical officers of health units in Sri Lanka. Those are the divisions where right now, with great difficulty, public health inspectors, the medical officers of health, and the other public health staff are struggling to contain the disease. So that unit needs to be recognized as the primary unit of COVID-19 control in Sri Lanka. It could not be the top level task force alone. They can't do that. Then if you have a devolved and a decentralized approach, you can partner with civil society organizations, private sector, local philanthropists to contain the disease. That needs to happen soon, and we are advocating for that. Not only advocating, I represent an organization which has an island-wide network. We have introduced the concept of creating COVID-ready villages, COVID-ready households, COVID-ready communities, and within our own resources and outreach, we are trying to do that. But it has to be scaled up. It has to have the government's full endorsement, which we haven't still had. But we continue to link those units with resources, and then have a lot of education programs through mobile units, through training religious leaders, community leaders, and so on. Then we also need to use the data. So some have also questioned in this chat box about the reliability of data. Yes, it's a serious problem, but I don't think, I think we know that whether it is a underreporting or over-reporting, whatever, we have a serious problem. So we have to, in the age of communication, age of this computerization, age of mobile communication, I think we can do a better job. If the data can be made public, the public can also organize themselves to be more responsible in the response, how to contain in their own area. Those of you who are living abroad, all of you come from some area that you have a connection with. I'm sure you are willing to help. If you know in your area that there is this need in the hospital, there is this need in terms of the negative impact of the people, you can help. And there is also people who are willing to take the responsibility. Right now, the problem though is that the transmission levels are very high, unlike previous occasions, whether it is tsunami or cyclone or any natural disaster situation where we mobilize large numbers of volunteers. Now they are restricted because they are also at least 1 in 2 families are affected by the pandemic. Now the death rate is rising, so somebody is dying every day. To over 200 deaths a day is a big number for a small country like Sri Lanka. Then the other response, so therefore we need to have the data decentralized, known to the public, so that you can plan proper interventions through partnerships. Vaccination, the government has done a good job in procuring vaccines, but the delivery has had a lot of operational problems. Again, that also needs to be decentralized, because we see every day now, the last 3 days, every place where they had mass vaccination, there were problems. They couldn't control the crowd, and there was a high risk. Even now, there's a high risk of infection being spreading at vaccination centers. So we need to have decentralized method where you can allocate time for people to come from different Grama Niladhari divisions at a given time slot. They can come and avoid. So these are very practical, very basic solutions that can be adopted, but unfortunately these common sense solutions have not been adopted. But we still believe in certain areas, the MOHs and those who really could plan well have done this in an exemplary manner, and we need to really give our tribute to them. Social aspect, the social impact. There are vulnerable groups, we know, low-income groups, daily wage earners, we all know the problems that they are facing. However, I'm still an advocate of having these restrictions and having a social support system which can be worked out. It's not just the state support system, the people support system. We are a culture still willing to help each other. Even today, as we speak, most of the patients and their families are looked after by neighbors. They somehow share their food. In 2 to 3 weeks time, there'll be food shortages. We just can't stock piles of food. So we have proposed, let's have food banks in each village. Let's have some dry rations and then pool them. People can donate and then can give to the people who are unable to access food. So these types of simple solutions, but in an organized manner, we need to think in the future. Then even though there are restrictions, certain areas can have more relaxed atmosphere to engage in productive economic activity. The 25 districts, if you take, still the transmission is low in about 10 to 12 districts in Sri Lanka. And those are largely agricultural areas. And even when you have lockdowns, agriculture is allowed. But there are sometimes people make blanket statements saying that all these lockdowns are harming the people who are engaged in informal sector activities. True, but there are mechanisms in which, because we need to cross this 3 to 4 weeks time period to stop the transmission. So one way is really to have that restrictions, but then help these people who are going to be affected temporarily. Then we need to also, of course, I think the previous speaker mentioned about the psychological aspect. It's a terrible trauma for families. Just imagine, one of your family members develop COVID-19 and develop serious illness, taken in an ambulance, you may not know whether that person will come back, and you may not even see the body. You can't do the last rites. Just imagine the trauma, right? So there has to be mechanisms, and we are also having helplines to help such people. So also, if you look at other vulnerable groups, there are elders, and there are children, there are disabled individuals who are living in care homes. We have a serious problem now. The care homes are also affected by COVID-19. The caregivers are affected. They are not vaccinated. Not all elders are vaccinated. The whole vaccination mechanism that was agreed upon at the very beginning, that was disrupted. The policy and the model that was initially done by experts and adopted by the government was not adhered to, and we are paying a very big price for that. So we have these elders homes particularly, we are very concerned, and now there is a situation where the elders who can't care for them need to be accompanied by a caregiver or a family member, and most of the time they can't, and therefore some elders are even dying in those care homes. So it's a very sad situation. So finally, I will stop by saying that we need to have a coordinated societal response, and it is possible even at this late hour. We can mobilize the compassion of our people, and also the intellect of our people, and also the best of science, the data collection methods. We can make predictive models. If we can't do it for the national level, we can do it for our own area, our own MOH division, our own divisional secretariat division, our own district, and then see this is how we can come up with containing this in our district. And this is the percentage of people who are going to be worse affected because of lockdowns or any other public health measures or social measures that are going to be taken to combat the disease. So we are proposing a social support system which can complement whatever the government mechanism, and then that can really be the base for the medium and long-term economic recovery. So to sum up, what I believe is, right now we need macro policies, we need to look at macroeconomy, but right now only way to get out of this situation, stop transmission or reduce transmission and minimize death, is by having a community-based approach, practical approach, so that you reduce the pressure on the care institutions, the intermediary care institutions, the secondary level hospitals, and the tertiary care hospitals. So I think we can do that, but if we can somehow get also the policy makers to agree, and this is what we have also proposed in the expert group recommendations which were released yesterday. So both myself and Dr. Abeysinghe are part of that team. So we are requesting that on one hand we adopt these restrictions on movements, but at the same time have a very strong social support system for the vulnerable people. We can mobilize religious institutions, we can mobilize civil society organizations, we can mobilize the private sector, and we are willing to give leadership to that. We are willing to be part of that. We have already started that, and you all can also be a part of such a mechanism. That way we can save Sri Lanka. Thank you very much.
Thank you, Dr. Ariyaratne, for your thoughts on how to proceed in managing the COVID pandemic out of the current devastation that is caused by due to many deficiencies in Sri Lanka. As Dr. Ariyaratne explained, the pandemic has overwhelmed the capacity of the health systems to cope. We have to note with great concern the current upsurge in COVID-19. It is heartening to see the experts working together, and movements like Sarvodaya getting the civil society organized to do whatever they can to help the people who are in need at this moment. There is only one way, that's a collective way, in providing a way forward with adequate care for treatment as well as prevention. And thank you for enlightening us about the perspectives on pathways to overcome the current crisis. And I would like to use this opportunity also to send our appreciation, collective appreciation, to all frontline healthcare workers, medical practitioners, nurses, attendants, cleaners who are working in all these hospitals, treatment centers, and so on, and also the health workers who are working with the people, like public health inspectors and people, the workers going from house to house, monitoring their situation and so on, and any others for their unselfish, self-sacrificing role and the spirit of service to the people at this difficult time. We are very grateful to them. And Mr. Gresham Firis has also indicated that we need to do that. And thank you, Mr. Gresham Firis. It is the discussion time now. And let us go through the questions posed and seek the responses of the panelists. And if we could go through in a quick manner, we have about half an hour, extended half an hour. I can categorize these questions into two main categories. One is they are asking about the government, the accountability, the legal liability, whether the health rights are enshrined in the Constitution, and so on. I think most of those questions are towards that. And then there is another question which is asking about the assistance provided by expatriates and probably even people in Sri Lanka, whether that is coordinated, whether there is transparency, and what is happening, is it prioritized, sort of, because there are so many requests coming. For example, in Australia, there was, I think, before Delta came into the scene, there was a request from the government, and people were collecting lots of things. They were very successful in collecting so much of funds, but then we don't know where it would go. There was no prioritization, as correctly said. So that is another question. So I think with regard to those matters, probably the best people to respond would be Dr. Ariyaratne and Dr. Nihal Abeysinghe. So I would like to invite them to speak on that. I know legal aspects will be very difficult to discuss here, but whatever we could discuss here. Thank you. Probably Dr. Ariyaratne could.
Vinya can start, I think.
Okay, thank you. So as I see, right now, I mean, I don't know much about the legal aspects, but I think accountability is going to remain. So it's in the best interest of the government to address that issue, even at this late hour. And really, there's also moral accountability. I would like to, emphasize that. So they may not have that moral accountability right now, but I think probably at a later point. Right now, there are many people who are demanding that. There are many rights groups, and they are doing it. But we are more concentrating on the current demands on the people's needs, and so we are concentrating more on that. So let the accountability debate be kept alive. But I think right now, because of the urgency of the situation, we need to focus our full attention, resources to saving lives and interrupting the transmission or the spread of COVID-19. That's what we are focusing. Now, on the overall approach, we are offering our assistance. We are offering partnerships, but it's up to the government to, accept and then find a mechanism to move forward. Even in the current task force, leaving aside the people, not the medical people not really having the decision-making power, but we don't see representation of other important sectors like the sociological dimension is not very well addressed, the psychological aspect. So these deficiencies need to be addressed, and I sincerely hope within the next few weeks these issues will be addressed. Otherwise, I think we can only do damage control after everything is deteriorated to a point that we can't prevent anymore. Thank you.
Dr. Abeysinghe, would you like to add anything?
Yeah, there are some questions in the chat box asking that whether we can coordinate some of this requests coming from the public and various organizations and hospitals. I think Vinya, perhaps that you may be having mechanism to coordinate ground level activities. Do you think that is it possible?
Yes, I mean, if people can contact, I mean, there are requests coming to us. We also have a helpline where people do call. So if there is a way that you can say that we can help in this particular aspect, I can link. Yes, we can link with the groups, and we can also be the intermediary. Already, I think some groups connected to social service organizations in Australia have done that, and we have connected, and we have also fulfilled those needs. So that's available. And there's also another question here or a comment that the hard lesson that we are learning about our own behavior, how we have exploited nature and done damage to the planet and environment. So I think this new normal is not going to come. I mean, we can never go back to the old normal. So I think we need to look at a new lifestyle totally. So within this crisis, we need to also engage people in how can we have a much simpler lifestyle, and a lifestyle that is in balance, in harmony with nature, and look at disparities, equity. This inequity, I think someone mentioned here, is absolutely important. Can we use this crisis to create a better level playing field for all people in Sri Lanka in terms of social opportunities, economic opportunities, and also democracy? So I think we have come to that point. So let's look at it positively as an opportunity, although it's a terrible crisis, but we need to treat this as an opportunity to change and to establish more sustainable systems, more humane systems in our society. Thank you.
Thank you, Dr. Vinya Ariyaratne and Nihal. Now, I will direct two questions in chat box, one to Dr. Sugirthan and then to Dr. Samarasinghe. Dr. Sugirthan, there's a question, probably a very short answer would be good because we are already running late. How can we overcome the stigma and fear among the infected and get them to report their infection and seek care? Is the involvement of the armed forces at the forefront intimidating people, especially the minorities? And I think probably Dr. Sugirthan could compare the situation in Australia with Sri Lanka, because it's two different systems where the armed forces, the involvement of armed forces in there.
That's it's again Dr. Nihal was saying in his presentation, public education again the important thing. So
I think we probably we can't hear you properly. A little bit more.
Sorry. Can you hear now?
Yes.
Sorry, the public system is actually need to be more emphasized. The public education is more need to be emphasized, and then reduce the stigma with health education among the community. So we are the MOH. MOH officer, MOH need to be lead those things. And the other thing is what I can tell is, as you said, it's armed forces involving in the care of, the people intimidating with that. That may be possible, can happen. But the thing is, at this stage, government doing that type of services via the armed forces. So no way to go beyond without go via the armed forces. So anyway, that is the current situation. So, but like what I would say is, with the public education, we need to be educate the people regarding the testing and regarding the COVID. So to take their own responsibility to control this infectious rate. Thank you.
Thank you, Dr. Sugirthan. I would like to add a couple of comments. One is that in Sri Lanka, there is no consistent process of communication. Communication comes via the armed forces mainly. So that is completely different from what is happening in Australia. Say in Australia, almost every day, the political leaders come to address the people and make them aware of what is going on and what is required, of the people. So in Sri Lanka, that never,
Yeah.
I haven't seen it happening. So, and in Australia, armed forces play a secondary role. Sort of the medical advice comes to the top. They give priority to medical advice, although politicians try to somehow or other try to dilute that advice, but still medical advice prevails. In Sri Lanka, we can't see that happening. So that is, I just wanted to add that bit.
Yeah, you are right, sir. Then it's adding up role normally forces doing in Australia. But like as you said, like every day we are waiting for 11 o'clock, update for New South Wales to get how many cases, and from their mouth only we are expecting that numbers and what are the restrictions they are going to impose. But in Sri Lanka, there is no proper channel to inform to the public. So that is again need to be looked into to improve the system. Thank you.
Thanks. Dr. Samarasinghe, I think there are a couple of points raised in the chat box. One is with regard to your concept paper, whether that is available to the people. The second thing is they're asking about Sweden, how they manage the situation in Sweden. Probably a very brief answer would be ideal. And I think there was another question. I can't. Were you able to note, Dr. Samarasinghe, in the chat box? Okay.
I have noted
about the strategic plan
from me.
Okay. Please go ahead.
Thank you so much for giving me the last chance to answer in these things. I think first of all, we have to think this is not just a health issue. This is a health, economic, social, and now it has become a cultural issue also because of this, what we do for the dead persons, because our practices in over a dead person is a big part of the culture. Now we all have lost them, but as you said, then we all have to think what we do in the new normal era, new normal world. Then if I come to the questions, then one gentleman has asked about Sweden. Now the thing is, Lionel, now we couldn't compare these Western countries, even the Australia, even the New Zealand with the Sri Lankan context. We are living in very different context. The practices we could apply for our people are totally different. Now, as Dr. Nalayini said, the individual, if we define the individual of our community, is not a one person. If you get a middle class person, of course, one person is one individual. But if you go to a slum in a Grand Pass or the Totalang or somewhere else, the individual person is 10, 15 persons living in one single room, 10 by 10 foot room. Then we have to take the person or the individual as a lot. Then when we apply our policies, we have to think those things. We cannot enforce our policies, what we are practicing in Australia or the Sweden or the Switzerland, directly to Sri Lanka because we are different kind of people. That's the biggest lapses we have done. We didn't understand who the Sri Lankans are. So, but now if you go for the Sweden again, now in the Sweden, the adult population is a very big part of the dermatology. And if you go for the youth also, the youth are single persons. Usually till the 40s, they don't get married. And like the other Western countries, even they do not go for the partnerships. Then they have to meet the partners outside. Then that's why the Sweden got the highest number of infection rate at the beginning. But yeah, that's the different scenario. Then somebody has about the how the Sweden or the Switzerland continue with this welfare things with keeping the economy on a run. So then again, in these countries, we have well-reserved, very big currency reservation. They can keep on in lockdown for years and years. And the welfare system also well-established one. Then they can keep their working community in houses by paying 80% of their wages without no issue. Then, but again, we couldn't apply these things to Sri Lanka. That's why we are suggesting separate fund when we can only use in the disasters. Then that's why I said there is a light of this COVID. Now, if we could make these policies now we can address the next pandemic, next disaster correctly. That's the message we can get. Now we are already almost in a hell. But as I said you, one day this will finish. The issue is what's the compensation we pay for that. So then what I am suggesting is we must take this as a whole. Then we can find the answer. Then again, as Dr. Ariyaratne said, then the health education is 50% of the control. As a community physician, he knows better than me. The biggest part of the community health also health education. Then we miss that because I also worked 3-4 years back in Sri Lankan normal medical practice. Then we know how the MOHs and those things are working. We have used to a very sedentary lifestyle. Just we work 3-4 hours per day, and that was the biggest issue we has faced. The army can give the injection by making the queues properly and all, but my own brothers and my own sisters in medical field, they just give the injection if the one person just entered the room, but they didn't think about the outside the room. Then there are many things we have to get corrected ourselves. There are questions we should ask from us. What we should do for this thing? Not only the government, as Ariyaratne and Dr. Nihal said, not only the government. This is a bilateral deal. Then the people also have some sort of duty, and the government also have some sort of duty. But both things depend on the good information. As somebody raised a question, what has happened when the army give the leading role in this management? The biggest issue is then we have to educate the who is that generals of the army to combat the corona. But if it is given the leading role to the medical persons, they already have some sort of knowledge with them, though this COVID problem is a new thing, but they have gathered a very big experiences with dealing with other endemic diseases and so on. But if we get the army, as Dr. Nalayini said, it's a supportive, it's a supplementary service. They have a role, of course, they have a role. Then in Switzerland also, in many countries, they give the support of the army for supplementary services. It's a very good thing because they also part of the nation. We couldn't neglect them, and they are well-disciplined force. That's why we suggest we should transform forces to National Guard forces, like in USA. Then when they are working with without weapons and all, then the people also build some faith on the army persons. Then they forget all about the past. Now they see the army also as their service. That's what we have suggested. And because of the time factor, then I would go for the last one. Yeah, that was the biggest mistake we have done. At the beginning, we lost the faith on the COVID management strategy because of the head of the COVID management task force. Then it has started from that somebody asked from us and at the chat why don't we think about the beginning of this COVID in China or somewhere? Or why couldn't we use the experience in China? Then if I give an answer again, the Chinese context is different. The decisions when we make from the top, there is a smooth run of the decisions to the bottom level, and if the people are misbehaving, then they use the arm to behave the people. But in a diplomatic country, in a democratic country, we couldn't do that. Then we couldn't take those strategies from other countries, but we can learn lessons from them. We can learn from them, and we can make our own strategy. That's what we are suggesting. So then there is another question, Lionel, about that vitamin.
I think we have to.
Yeah, the last one.
Yes.
Yeah, then there are some vitamins, antioxidants like vitamin C and vitamin C that can boost the immunity, but it just give a general immunity. But you should have the vaccine to get less number of deaths. And I would say at the end, I think most of the deceased or the death has happened the person who have not got the vaccine. Then what they have done, because they have believed on the house remedies. You know, the house remedies has done a big damage to our COVID control because of the lack of information, because of the misinformation, because of the false information. So thank you very much for Lionel and the organization for organizing this great event. Thank you.
Thank you, Dr. Samarasinghe. I think we have to conclude this webinar. It is 20 past 11 here, close to midnight. I take this opportunity to thank the panelists, Dr. Nilanga Samarasinghe, Dr. Nihal Abeysinghe, Dr. Nalayini Sugirthan, and Dr. Vinya Ariyaratne for their enlightening presentations. The issues we discussed here will continue to persist, and we need to cautiously monitor future developments. And if we could follow up helping the people of Sri Lanka in some way, I think everybody would appreciate that. On behalf of Voice for Democracy in Sri Lanka, I would like to thank all the attendees without whom our webinars would not be successful. You actively participated by posting comments and posting questions, and that kept the webinar livelier and more interesting. Let me also thank Mr. Ranjit Veerasinghe and Mr. Gratian Anthony for their invaluable assistance. I am thankful to Mr. Mansoor and Ms. Senaratne for their assistance in translations. We need to take care as the escalating COVID pandemic devastates human lives everywhere. We are grieved by what happens in Sri Lanka, where the infected numbers and deaths are increasing rapidly. I wish you a good morning, good afternoon, and good night, depending on from where you have joined in. Thanks again, and goodbye.
Bye.
So goodbye, everybody.
Thank you very much.
Thank you. Okay.